How do I find a specialty psychiatrist? It's very important to find a psychiatrist to work with who knows OCD and related disorders well. There's lots of reasons for this, including the ability to accurately diagnose OCD and related disorders, understanding things like how to start liquid and low-dose titrations or the indicated maximum doses for these medications, as well as to be able to have a good understanding of exposure response prevention, ICBT, ACT, other psychotherapies used by therapists that we can coordinate together, and so that us as a psychiatrist can include some of that psychotherapy in our visits together to support your growth. Here at Anxiety Relief Clinic, we're happy to work with you if you're located in any of our licensed states, which does change over time, so explore our website. Another great resource is the International OCD Foundation's directory, which can be found at www.iocdf.org/find-help. That website includes therapists as well as prescribers who specifically have training in this space. How do I find a specialist in my insurance network? It can be difficult to find a psychiatrist who is trained in OCD management and in network with your insurance accepting new patients. That's why it's always important to start by checking the directory so you know you get someone competent and then seeing which insurance they take. However, if you really do need to work with someone in network and you're not finding a good option, another way would be to check your insurance company's website for their directory, calling them, or checking with third-party groups like Headway or Alma, which sometimes contract with psychiatrists and nurse practitioners and can list if they focus on OCD or anxiety disorders on their profiles. If you do see this information, in general, I recommend working with people who specifically focus on OCD and anxiety rather than it being part of a long list of unrelated disorders that they see. If you see someone who works with depression, anxiety, PTSD, psychosis, bipolar, what we're talking about is a generalist, and that can be good, but it's often best to work with a specialist who focuses on this population, knows the latest research, and has good skills in titrating medications to OCD and related disorder dosing. How much do medications cost, and what if I don't have insurance? Luckily, most of the medications used for OCD treatment have been generic for many years, which means they're pretty cheap. Sometimes even without insurance, they can cost just a few bucks for a whole month's supply. Patients are often spending $0 or just $5 on a copay for a month as well. It does depend on your insurance though, and if you don't have insurance, the bigger obstacle is probably going to be getting someone to prescribe the medication rather than the cost of the medication. For some of the newer medications, they are more expensive, and that's why it's important to check with your provider about the cost when they're prescribing or what they think the cost might be. How often will I need to see my psychiatrist? Typically, visits with psychiatrists start off in the every 2 to 4 week range, and then slow down from there depending on how you're doing. A monthly cadence or monthly visits is the most common while you're still having changes to your dose of medications or just learning more, growing early in treatment. Once things are more stable and we're not making changes, we'll often decrease to about every 3 months, maybe even longer. Will my psychiatrist collaborate with my therapist or other members of my care team? It's very important that your psychiatrist be able and willing to coordinate with other members of the care team. Certainly in our clinic, we do. In general, any kind of coordination we do has to be done with your approval. That includes making sure that we have a release of information on file, making sure you consent to it. Should I do genetic testing to find out which medication works best for me? In general, genetic testing is not indicated for the treatment of OCD or other conditions using psychiatric medications. There are genetic testing groups out there, and there are certain situations in which they may be helpful, but applying it broadly to people coming into treatment has not been shown to improve clinical outcomes, so it's not generally recommended. It is a good thing to discuss with your healthcare provider though, so feel free to ask if you want to learn more about it and why it is that we don't routinely do it. Is it better to do telehealth or in person? There's generally not thought to be a big difference between seeing your psychiatrist via telehealth or in person. There may be some differences in psychotherapy, but for most psychiatry sessions, you'll have a pretty similar experience, especially since things like medication prescriptions are all done electronically these days anyways.